Please welcome the CEO and co-founder of Oscar. And if you've seen their ad campaign, you know what I'm talking about here. Mario Schlosser is an entrepreneur and the CEO and co-founder of Oscar, a healthcare insurance startup that is a very, very different way of offering insurance and healthcare reimbursement. Please welcome Mario.
All right, get connected up here. It's great to be here. I'm Mario Schlosser, the co-founder and CEO of Oscar Insurance. We're an insurance company, as simple as that. We got started about 3.5 years ago, and in New York State, where we originally got going, we were, I think, the first commercial greenfield insurance company in about 10 to 15 years or so. I'm getting connected up here. Okay, excellent. About 10 to 15 years or so. So insurance companies don't get started a whole lot. Just before I go a little bit into the background of why we started the company and tell you some stories about how we're thinking about building the company and why we do what we do, I'll go a bit into the background of who we are so you get the facts right. We're a licensed insurance company, New York, New Jersey. We're selling only individual market right now, on and off exchange. So the Affordable Care Act was a big catalyst for us to get into the market, really. And in just about 4 weeks from now, we're going to be starting to sell also in California and Texas. So you can imagine I'm somewhat busy right now with the whole team as well in New York. We got founded in 2012 and started paying claims on January 1st, 2014. Really started selling in late 2013, got our first members through the exchanges in New York. And now at about 40,000 members, 200 million in premium spends, and reached about 17% market share in the last open enrollment period in New York, which and New York is the most competitive insurance market in the country, really, from a number of insurance companies' perspective. And so that's a good sign to me that we're onto something right now. It's the first 2 or 3 years or so of a hopefully multi-decade story for sure, but I'll take you behind the scenes and show you some of the stuff we've been building. Funded by some of the big Silicon Valley investors with sort of like very deep long-term interests in trying to do something revolutionary and transformative in the healthcare system. Okay, so I'm a computer scientist originally. Why would I go into the worlds of health insurance and try to start a health insurance company? Well, as with many other hopefully impactful products, it was personal. About 3.5 years ago, my wife was pregnant with the first kids. We now have 2 kids. I can recommend having kids when you find yourself starting an insurance company. They're great test subjects of the insurance. And so I became a big utilizer of the healthcare system, trying to find pediatricians, understanding, the EOB, this is not a bill. Well, why does it look like one then? Finding quality doctors and all these kind of things. And so that was at the beginning of Oscar, because I don't know if you noticed, but healthcare doesn't always make sense to the layperson trying to navigate this system. As an insurance company, we try to sort of like think in this flywheel and do this, what we have on the screen here. First of all, signing people up, as simple as that. And this is already very different than the way insurance companies used to sign people up. Now you're in individual markets. You can build a brand. You can build brand equity. You can have conversations with individual members on the phone, build a product that they will really fall in love with and things like that. So we do that very diligently. All of our salespeople on the phones are in New York in the same building that we're in. I'm on the phone, actually, if you call before the deadline, and trying to explain plans to you myself. And we build trust with members from the get-go and try to engage them with the products and try to make sure that members look at Oscar as the entry point to the healthcare system almost, and use our tools in guiding them through the system. And as they use our tools, compile more and more real-time insights into what's happening with their health right in that moment, try to engage them on that. Share all that back with providers. We wouldn't be able to do all this without trying to get towards an end-to-end experience with providers. So the data we collect, the triggers we see in members' health, we try to push them back into the healthcare system for members to be in good hands there. And then really healthcare is probably one of the only industries where you can say this without sort of blushing here. You can probably build over time a better product at a lower price, hopefully. So far, the beautiful theory. Here's the somewhat ugly reality starting points. What is this? This is the so-called Federal AV calculator. It's an Excel file. Every insurance company selling the Obamacare exchange has to run their plan designs through. It looks very complicated. Not surprisingly, ugly complexity breeds ugly complexity. Here are the standard plan designs of a plan in New York. Silver, gold, platinum. You can buy this in the exchange. Very complicated stuff. Lots of co-pays, co-insurance, and so on. This is not a good starting point to think about a consumer product. And this is sort of like layers and layers of civilization, of thinking, of reimbursement policies that maybe altogether nowadays don't make a lot of sense anymore. So we try to think in this framework here when we build products and when we build things for our members. We try to sort of say what are services that are low cost versus high costs, and what are services that affect few members versus many members. And these services or these sort of like clusters here form member segments that have very, very different needs and that need to be addressed very, very differently. If we sort of like overlay our own cost distribution, percent members versus percent costs of Oscar 2015 against this, you can kind of see that in the bottom left quadrant there, where many members don't utilize a whole lot, we have about half of members, and they only generate about 2% of our costs. In the bottom right quadrant here, we have about 43% of our members, and they generate about 30% of our costs. So some more chronic conditions, some more physician visits, specialist visits, and so on, radiology, et cetera. And then up here in the top right quadrant, you have a small share of members, but generating the majority of the costs, really. What we now do at Oscar is we try to combine all the various data points we have about user member at any given point in time. So one thing we also do is we talk to you about the needs you have and the issues you see and things like that. And that's how we can now actually look at what members need in these different quadrants here. And what it turns out is that in the bottom left quadrants, we have people largely buying high deductible plans for catastrophic care. People want to get some other value of their insurance than just this notion that eventually they might go to the doctor. They want to see some rewards, some things that keep them well and things like that. In the bottom right quadrants, where you utilize just enough to be confused, but not enough to ever understand fully what's happening in the system, you want to get better explanation, better idea of what happens, what the benefits, how the benefits work, how the system works, etc. In the top right quadrant here, not surprisingly, when you're going through a difficult time, have a difficult condition, you're chronically sick, or you have an inpatient procedure, you want easier access, easier connectivity to your physicians and things like that. So I'll take you through a couple of things we've been building in these different quadrants and show you some early anecdotes and data around how that's been working. Let's start with the bottom left here. Super simple story. How can we get members to get more flu shots? Here's when we looked at a segment of members last year between October and December or so, and measured just how many people go by themselves to a pharmacy to get a flu shot. This is about what happens here. 15 to 20% or so go up the couch and get a flu shot. This is the Oscar website, and one of the things we have in there is a notification system that takes lots of data, runs it through a triggering system, and then triggers certain notifications or other types of outreach. And one of the things we triggered there is we told people $20 if you get off the couch, get a flu shot over the next month. And then this is what happened when we did that. So again, the control group, no rewards. And here's the target group with a rewards, about a 2x increase in people getting off the couch, getting a flu shot. It wasn't a big flu season in New York, actually, and so if we do the actuarial math, any rewards lower than $6 would have even broken even for the insurance company if you sort of like consider the amount of flus we avoided by giving out these additional flu shots, which now helps us to sort of like fine-tune this reward system for the years to come. Another really simple story here. When you onboard with Oscar, we want to know as much as we can about you so we can understand what your needs are, how we can help you get through the complex healthcare system. So we used to pay you $10 for filling out a bunch of questions in the form of a health assessment or health risk assessment, as insurance companies like to call it. And we got about 2/3 of members who come online, which is about 95% of our membership overall, to fill this out, which is a fantastic number already. Then we thought people love our health assessment. Why don't we just get rid of the rewards and let them fill it out anyway? Lo and behold, numbers fell a bit, 51%, still pretty good. But now the question became, can we somehow redesign this product itself? Not thinking about financial incentives, but about the way the product operates to make people still fill this out because they see a reason in filling this out. And so we launched this thing here, again, screenshot from the Oscar website, open for all members. A preventative care recommendation module, if you will, which essentially takes this health assessment you filled out and tells you among all these various services that the ACA says you can get for free in any given year, which ones are the ones that are most appropriate for you that you should really think about getting. And behind this, there's an appointment scheduling engine. When you then actually click a button, we can take you and schedule an appointment with a physician or with a nurse or something like that. But that's what you get here. And so this shows a so-called SAM key here, a user flow on the sides. What you see there is in the middle, the health assessments. From the left, the people come in who go through the onboarding checklists when you're a new member. From the right, you see the flows from people coming, hitting that brand of discovery tool, and then saying, okay, I guess I got to fill this out, and coming back to the assessment and filling it out. And that, therefore, when we launched this thing here, shot up to about 70% of members again, and people filling this out, which to me always means utility trumps financial incentives. Financial incentives are very important, but you got to, in a sense, remember what you're doing something for, and that's then the most powerful thing in driving you to make behavior change. Okay, so that was the quadrant of members who don't use their insurance a whole lot, but needs some kind of utility. I should have said before I went into this thing here, we need all these members. We cannot live without any of these quadrants here as an insurance company. We need the members who don't use their insurance plan a whole lot to balance the books. We need the members who use their insurance plan a lot to really make sure we operate the healthcare system well for them and on their behalf, that we have the right kind of service and the right kind of service level and drive the right kind of quality. And so all of these different quadrants require our work and our attention. Actually, before I go in here, so bottom right, many members utilizing services like office visits, preventive, and so on, but the cost already rising a bit more. Let me show you something in the website here. If you recall, that was a quadrant members that was largely sort of confused about their benefits and how to understand the system, how to operate it. This is the Oscar website here. It's my own account here. It does a whole bunch of things. It would take way too long to demo to you now, but come see me afterwards and sign up for the plan, then I can show it to you in more detail. It does things like show you all your health history in complete detail, in real time, things like drugs you picked up, who prescribed it, obviously all clickable, which pharmacies do you have drugs waiting for you. This is one of my prescriptions from last week. My nose was running quite a bit. And so the other thing I can do is query this thing. I can say, I can't stop wheezing, and then there's some natural language processing that then looks into this string and says, what are some conditions you may want to look into here for? Click on asthma, and then we go through and sort of curate for you who could help you with this particular condition here under your plan. And because of a deductible, some of this will actually cost me out of pocket. We project that out for you. You can see this on a per physician basis as well. And the other thing we put in front of you is completely free 24/7 televisits, which we became, I think, the first insurance company to do really broadly across all the membership we have. And we consistently monitor what happens with these televisit phone calls. And therefore, we see that asthma conditions going to these phone calls get resolved in about 88% of the time, meaning there is no follow-up claim afterwards for a phone call regarding asthma. Right now, I have to wait about 9 minutes for a doctor to call me back. I won't click that now because the phone's going to ring while I'm still on the stage here. But it knows everything about me. When the doctor calls back, it pushes out my health history to the physician, additional messages we want to attach to this. Doctor calls me back and can prescribe me things like that. This is then what happens with this kind of benefit here. We look at, again, what are the conditions people call us for. They tend to be a lot of common conditions like bronchitis, respiratory infections, and UTIs, and so on. But the astounding thing, again, is look how much of a shift in costs these televisit phone calls now broadly available actually affect. Just the bronchitis, for example, when we take care of it now over the phone, it's about $57 of cost for Oscar. That's the combination of a prescription and the phone call of the doctor. Remember, it doesn't pay anything for that because we make it totally free. If that condition goes into the rest of the system, it right away goes up to $227 for us and some out-of-pocket cost of the member as well. So it's quite powerful. Even in the case of sprains and strains, about 41% of phone calls don't lead to follow-up claims because the physician sort of figured that this is okay, put some ice on it, and you're good to go. So this reduces in emergency utilization, urgent care utilization to levels that make sense. Another example for interesting product design, a sort of interconnectivity in the way we're building things really is this one here. We gave members at the beginning of the year a fitness tracking device. So a Misfits, one of the fitness tracking devices out there, and the Oscar app does something very simple. Obviously, you can search doctors and you can see your health history and so on, but it also pays you $1 a day for hitting certain step counting goals. And those goals are set based on your previous week's activity and things like that. This will, in the long term, hopefully have a population health impact. You're measuring that very closely. We can share this information with providers as well. They can incorporate this into your care management plan, things like that. But the other thing it did was this. It actually drove televisit utilization. We looked here at the population who was with us in 2014 and who didn't get a fitness tracker. The utilization of televisits that they had. They called us at a rate of about 15 calls per month per 1,000 members. Went up a bit from 2014 to 2015 just because we were doing better product marketing and things like that. But here are the people who did pick up a fitness tracker. They started higher, more of a self-selection of opting into using technology, but also rose a lot more. Because now that you're using the Oscar app on a daily basis to collect your $1 a day, all of the things the app can also do for you are more top of mind and will drive your behavior more. Again, a very, very good example for how everything we do has to be very tightly connected and thought through. And now, probably the most difficult quadrants in the membership base, the few members, the 2% or so who drive a large share of the costs. Those are, of course, the ones we all are worried about the most from a quality perspective, from a cost perspective, from a user happiness perspective, so to speak. And we really, at this point, are working at this from a whole variety of different perspectives. And one thing I think we see as well here is that all of the tools we're building for any other member who's not going through a difficult inpatient procedure right now work for these members as well. Here, for example, is the televisualization by health status. So sorting members from rather healthy on the left to rather sick on the right, and then looking at the % of people who had a televisit phone call in 2015. You actually see it's rising towards sicker members. So even though you are in treatment for a particular difficult condition, does not mean that you don't also like the convenience of when you have something simpler going on with you, just pushing a button, having a doctor call you back. Ideally, of course, it's the same doctor who you're in treatment with calling you back or seeing you with a video chats easier way, and those are things we're currently building as well. But even this already works quite well. And the other parts of taking care of very sick members really is just this. This is our nurses team, part of our nurses team actually, their Instagram accounts in this case. We think that if you really are dealing with members who are going through complex conditions, in the end, it is a very, very personal situation you have to work on very, very closely with a nurse. And so our nurses reach out to members who we identify as having complex condition. They help them through it. We have a variety of protocols we can walk people through. And the reason why I think it becomes more powerful in the way we do it is for two different aspects. One is our nurses have much more visibility into what's happening. All of the data that we generate about members go into systems the nurses can use and can look at and see what is happening with members I can take care of. And the second thing is because of the engagement we get, meaning these nurses don't necessarily just have to cold call members. They can reach them through making their phone buzz through the Oscar app. They can reach them through the Oscar website and some notifications in there. They can reach them through a variety of other means that typically are not at the disposal of insurance companies. Here's one of those examples. I just took the screenshot this morning. This is one of our backend tools now here with the only insurance company in New York City that has a real-time link to all the emergency rooms, which means we see literally in real time when members get checked into an emergency room or get discharged from a hospital. And I took out all the identifying information here, but our nurses can see a lot more detail now here. And you can see we hadn't had an ER visit this morning, but we had 3 ER visits yesterday. You can also see how the system automatically assigns nurses to the various patients who are now in various states of the healthcare system and run them through sort of like an outreach protocol and get in touch with them. So that was sort of like the whirlwind tour of what we're building right now. The 3 things we want to optimize for really are member happiness, first and foremost, because in this individual market that we are in, that's the thing that makes the biggest difference between members staying with you, not staying with you. Quality of care, of course, and we do believe that by tracking much more closely, much more in real time, what is actually happening with you and having a much broader view of your health care and your health history than any individual provider in the network even has. We can actually push up quality as well. And the third, of course, is costs. In the end, members will vote also based on what the premiums are. And so over time, we hope to be contributing towards the lowering of healthcare costs across the system. Finally, I want to end here with, we are going to be in these markets at the end of this year. So if you find yourself in one of these markets and you want to switch from your insurance carrier or you are missing insurance, then definitely give us a call and we'll walk you through the plans we have and get you into the membership base. Thank you.